Hello and welcome to my video on statins. I will give a broad overview of this class of medication to serve as a review or an introduction to anyone wanting to learn more about them. This information will help you if you are trying to learn more about these medicines for your patients or if you yourself are taking them. Firstly, why do we call them statins? Well, that is because every drug in this class ends its name with statin. Atorvastatin, rosuvastatin, pravastatin, they all end with statin. This also makes this class very easy to recognize. This is a good thing, as these medicines are very widely used and common. This is because they are very good at lowering cholesterol, or what is commonly referred to as bad cholesterol, or LDL. Now this bad cholesterol, if you will, can really cause some issues which can lead to heart attacks, strokes, and blood flow issues. All conditions with very serious implications. Before I get more into the statins, though, I think a brief aside into cholesterol might benefit us all. First of all, cholesterol is needed and good for your body, but just like with anything, too much of a good thing can be devastating. So cholesterol helps your body function by making hormones, digesting fats, and, in an oversimplified way, protects all those little cells in your body. Now realistically, your body makes enough cholesterol by itself where you do not have to worry about adding any into the system. So you do not need dietary cholesterol or to consume cholesterol such as with certain vitamins and minerals. But most of us like a little fat in our foods in one way or another. Talking about fat in our food, I do want to put a little aside in here. The common thought today is that the only foods that can raise your cholesterol are meats, cheeses, animal products, if you will. And yes, they do have cholesterol in them. But any food that has a high fat content can raise your cholesterol if you indulge in it too much, such as nuts, certain vegetables, and of course oils used for cooking. The problem lies in too much. So when you have an excess amount of fat or produced cholesterol in your body, it has to go somewhere. And sadly, some of it starts sticking to our blood vessels, reduces blood flow, which can ultimately lead to major consequences and damages to our vital organs, namely the heart and brain. Important stuff. Okay, back to the statins. Since cardiovascular conditions are so rampant, of course medicines were needed to combat this, and statins met that need. They are excellent at reducing cholesterol levels by more than 50% with just these singular drugs. Now, of course, they do not have to have that extreme of an effect, if you will, since not everyone needs that much cholesterol lowering. Because remember, cholesterol is still not inherently a bad thing. That is why the statins are divided into three main categories. So you have high-intensity statins, moderate-intensity statins, and low-intensity statins. The high intensities are the ones that should bring the cholesterol down by at least 50%, whereas the moderate-intensity statins are shooting for in between 30 and 49%, and then the low-intensity ones are less than 30%. All that is to say that while they all work the same, this treatment should be individualized just like with all medicine and medical practices. Now obviously the higher chance someone has of having a negative impact from their cholesterol, the higher the intensity. And not only the specific drug, but also the dosing is what ultimately dictates the intensity provided. So now that we understand the importance of statins and why they are so commonly used, let's talk a little about how they do what they do. Statins are called HMG coenzyme A reductase inhibitors, which basically means that they inhibit or interfere with a specific enzyme which helps our body make cholesterol. Now this enzyme is important because it is the rate-limiting step in cholesterol synthesis, or the really important aspect in the process which determines how much cholesterol is eventually made. This happens in the liver, which will be relevant a little later, and is how the statins cause our bodies to make less of the LDL, or bad cholesterol as it is called. Interestingly, with the reduction of LDL being made, the body increases its attempts to grab LDL to reabsorb it, which then further decreases the cholesterol amount floating around in your blood vessels. But just like with any drug, there are side effects which can happen as well. The most serious involves the muscles. It presents as muscle weakness versus tiredness for most people, typically in larger muscle groups such as the thighs, say when you are going up the stairs or the like. It is symmetrical, so it will be apparent in both legs, and if it is going to happen, it is more common in the first 6 weeks. But sadly can happen at any time while someone is taking these medications. In severe cases, it can lead to the breakdown of muscles and cause kidney issues. But as long as someone is aware of this side effect, it shouldn't get to that point. The positive thing is that this side effect is reversible, so the solution is to just stop the medication and it'll go away. However, as we have already discussed, these are important medications. So if someone needs to stop the one they are taking, they can actually restart with another drug in the class, and there is a solid chance that the muscle issues won't return. Typically, you would want to try up to 3 different statins before saying you cannot take them. That is how highly regarded these drugs are. There are other side effects, with another common one being joint pain. This can go away after taking the medicine for a while, but it may not. It doesn't cause damage to the body, so it is up to the individual to weigh the pros and cons about this side effect. Statins can also raise the sugar level in the body to a degree, so a diabetic person should be aware of that as well. Some other things to keep in mind is that these medicines cannot be used when someone has active liver disease. Remember, they work in the liver, so if the liver is not doing so well, statins are not the answer. Also, they are a no-go in breastfeeding. It can disrupt the child's cholesterol management within their own body. Recently, the FDA has changed their stance on whether a pregnant woman should take statins. From the beginning, they were not to be used during pregnancy as it could cause miscarriage or, rarely, birth defects. Now the FDA says it depends on the situation. I would still encourage you not to use these during pregnancy and seek alternative treatments. To wrap this up and veer away from the side effects, when to take these is actually important in some cases. Other than rosuvastatin, atorvastatin, and pitavastatin, for the most part all the other statins need to be taken in the evening or before bed. This is because most of the cholesterol made in your body happens in the wee hours of the morning. A good chunk of the statins interact with other medicines, so that does need to be taken into account. And even some other medicines which are used for cholesterol management can interact with statins as well. Coenzyme Q10, or CoQ10, has had some mixed results and considerations in regards to statin therapy. But overall, it does seem to help with some of the muscle issues associated with statins. So someone that has had to try another statin because they did not tolerate the first one might benefit from CoQ10. To finish up, I do want to point out that statins are preventative medicines, which also means they aren't going to make you feel better when you take them. They just reduce the risk of cardiovascular events such as stroke or heart attack. And that risk has been calculated on a 10-year scale. So slow and steady wins the race. Also, something to consider when older people are started on it as well. That concludes my overview of statins. I hope that this has benefited you in one way or another. As I have mentioned, this class of medication is great for lowering cholesterol and really seems to save lives. I release videos fairly regularly on medications and pharmaceuticals, so if you like quick, concise overviews, I hope you subscribe so you can keep benefiting from my videos. Have a good day.